Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, May the 17th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations tomorrow, Tuesday, and Wednesday. You'll get written briefings with the relevant information with respect to the COVID-19 pandemic in BC at approximately 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. Today we're reporting on three periods. From Friday to Saturday, we had 443 new cases of COVID-19 diagnosed in the province. Saturday to Sunday, an additional 493 people were diagnosed with COVID-19, and in the last 24 hours, an additional 424 new cases. Our total for the weekend is 1,360 people newly diagnosed with COVID-19, bringing the total number of people in British Columbia to 139,664. Of the new cases this weekend, 291 were people in the Vancouver Coastal Health Region, 861 were people who live in the Fraser Health Region, 36 people live in the Vancouver Island Health Region, 126 in the Interior Health Region, and 47 people live in the Northern Health Region. We currently have 5,021 active cases across the province, of whom 350 people are in hospital right now, 132 of whom are in critical care or ICU. And we have 132,841 people who have recovered from their acute illness with COVID-19. There are no new outbreaks to report in the province today, which leaves us with 3 active outbreaks in long-term care, assisted living or independent living, and 2 in acute care units. Sadly, this past weekend, we've had additional deaths. 14 people in British Columbia have died from COVID-19, bringing the total number of people who have died from this virus to 1,648. Of the people who passed away this past weekend, 12 were people 60 or older, 4 each in the 60 to 69 year age group, 4 in the 70 to 79 year, and 4 were in the 80 to 89 year old. In addition, we had 1 person in their 40s and 1 person in their 50s. And this again reminds us that this virus, while differentially affecting the seniors and elders in our lives, also can have severe effects on young people, including people in their 40s and 50s and younger. And our condolences and our thoughts are with the family members, with the caregivers, the people who knew and loved all of those who died this past weekend. So far here in British Columbia, we've delivered 2,528,398 doses as of yesterday of all 3 COVID-19 vaccines. And this means over 55% of eligible adults 18 years and over have now received their first dose of vaccine in British Columbia. We've also given 130,023 second doses, which is about 3%, but we know that many people will be coming due in the next few weeks with their dose too. Everyone in BC now who is 18 years of age or older can register and book your appointment. It is now your turn, all of our turn, and I encourage everyone to get immunized as soon as you can. The data we shared last week reminds us that it takes as long as 3 weeks or longer to have the full protection from these vaccine doses. So the sooner you register and book your appointment and get your vaccine, the sooner you will have the protection that we are all looking for from this dose. Later on this week, I anticipate we'll be able to share more details about vaccine availability for youth, 12 to 17 as well. I do want to take a minute to talk about the second dose for people who in British Columbia who've received the AstraZeneca vaccine since we had our first shipment in about mid-March. We know that this vaccine, from the clinical trials and from the evidence that we've seen in other places, including the UK and here, that the protection that you get after dose 1 with this vaccine goes up over a period of as long as 12 weeks. And we know that even a delay for up to 12 weeks means that you get better protection from the vaccine. And that is the way that our immune system develops both our antibody protection and the cell-mediated protection over time. The remaining stock that we have of AstraZeneca here in BC, and we have kept somewhere in the vicinity of about 20,000 doses, is good until the end of June. So it does not expire. We know that there's been reports, and some of the lots that were received in Canada and some other provinces expires at the end of May. We have used up all of the AstraZeneca that we received that expired early on in May, and we now have vaccine ready and waiting for people for their dose 2, that we have some time before you're due for that, and we know that your immune system is well primed, and time because the vaccine is, the expiry date is not until the end of June. So for all of those who have received their first dose, you will have the option of receiving your second dose of AstraZeneca. And I know that's very important for many people. They chose to receive AstraZeneca because of the way the vaccine is produced and the effectiveness that we've seen from this important vaccine in other places. But we will have more information as well in the next few weeks to give everybody all of the information they need to make an informed choice about what you wish to receive for your second dose if you received AstraZeneca. And I say in the next 2 weeks, by the first week of June, we expect to have all of the results in from the immunogenicity studies that were done in the UK and other places to understand if there is the same or better protection from receiving the AstraZeneca first and then a Pfizer vaccine second. So I ask people to be patient. We know that we have some time as your immune system is developing its protective response to your first dose. You will have the options of receiving the second dose of AstraZeneca, and we have stocks coming in to be able to support that. Or you can take the information once we have it and make your own decision about what you want for your second dose. So I just want to reassure people that we have not forgotten, and we will be providing the information as soon as we get it to help you make those decisions. I know as well that for many people this May long weekend is often the unofficial kickoff to summer. And I know that we are all looking forward to this summer being different. But we are not yet ready to make any changes to our current provincial health orders this week. This means this long weekend it is important for all of us to stay the course. That means staying local, staying small, and remembering to use all of our protective measures, even as more and more of us are immunized and we pass that critical period of time that our immune system is ramping up to protect us. As well, we now have 400 to 500 people a day that are still testing positive for COVID-19. And that reminds us that the virus continues to circulate. And we have to do all we can to stop those transmissions as we're all developing this protection. That's why we can't be making any changes right now. We can't be traveling, and we can't be having large gatherings this weekend. But after this, we will be able to move on and move ahead. And we will be reviewing the number of people vaccinated, the peak at 3-week effectiveness, as well as the level of community transmission over the next few days to determine where we can go from here. And there is a plan that we will be presenting to you. Until then, we all need to hold the line. What you do today determines where we will all be 2 to 3 weeks from now. And that's why everything that we're doing right now is going to make a difference for our summer. I don't think anybody wants to see a surge in cases in 2 weeks. That would just set us back again, and we don't need to do that. We need to keep moving forward. We know that now over 55% of people 18 and over in this province are immunized, and their protection levels are going up as more and more of us are getting started on that path. So we need to continue to hold the line right now and continue to support each other to get through these next few weeks, to be kind to each other, to be calm, and to stay safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by passing on my condolences to the families, the friends, the caregivers of the 14 people who've passed away related to COVID-19 in the past 3 days. These losses are considerable, and 14 is a great deal. 1 is a lot, 14 is a lot as well. We know it's difficult. We're still we still see strong limitations in our ability to come together and grieve our losses, and that's why all of us have to provide in every way we can support to those who've lost loved ones in this pandemic. I wanted to note, and obviously Dr. Henry has said this, that there are 350 people in hospital related to COVID-19 today, 132 of those in critical care. And while those numbers are lower than they were at the height of hospitalizations in April, I think the height was 511 hospitalizations. They are still, if one wants to put it in context, significantly above what they were last April at the height of the first wave, for example, when 149 people were in hospital and 72 were in critical care. With respect to acute care beds, we have 713 base beds, vacant base beds across British Columbia, and 101 vacant base critical care beds. But more relevant and more important, currently 128 surge beds are in operation across health authorities, and 14 critical care surge beds are in operation, indicating the continuing stress on our healthcare system in spite of the significant drop-off of the number of cases in the last few weeks. So I want to acknowledge, as we do all the time, but all of our healthcare workers, whether they be in the community and long-term care and acute care, for all they're doing right now, and the need for all of us to support them, especially right now, when we continue to see significant cases between 400 and 500 each day this weekend, and a very significant number of people in hospital, that we support our public health workers by doing what we need to do, which is following public health orders and following public health guidelines. As Dr. Henry has said as well, we've had a significant level of immunization, and we continue to, so that about 55.8% of British Columbians have above the age of 18 have now been vaccinated. In the coming week, we expect to receive from the week of May 17th to 23rd 276,120 doses of Pfizer, 142,500 doses of Moderna. The latter are expected later in the week, possibly through the weekend into the following week. But this is obviously another significant amount of vaccine coming into British Columbia. I also note that 86% of those over 70 have received their first dose vaccination, 82% of those over 60, 77% of those over 50, and 70% of those over 40. And those are significant categories because, as we've noted from the beginning of the pandemic, it's in those categories where the greatest risks exist, although it exists, of course, for all of us. I'd also note that more than 200,000 clinically vulnerable people have been vaccinated in British Columbia. And what this says to us, what it all says to us, given that everyone can now book their vaccine appointment in British Columbia, 18 and above, that it's time to register. It's time to book our appointment. It's time to get vaccinated. That one person getting vaccinated wherever they are in whatever community they are in helps everybody else deal and see that much sooner the end of the pandemic. So I encourage everyone to register at the Get Vaccinated website, or if they need to call 1-833-838-2323 and get their shots. We need to encourage each other, our family members, our friends, our workmates, to go and get vaccinated and to take that vital step to keep ourselves and our communities safer and move us from where we are now to the future that we want. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence. Il y a eu 14 nouveaux décès liés au COVID-19 durant cette période de référence. Nous offrons nos condoléances aux familles et aux amis des 1648 personnes décédées de COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 443 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 16 mai, nous avons eu 493 nouveaux cas. Au cours des dernières 24 heures, 424 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 350 personnes sont actuellement hospitalisées, dont 132 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. First question, Keith Baldry, Global News.
Hi, thank you for this, Dr. Henry. Regarding AstraZeneca, given that it's now going to be no more first doses, at least for now, is it likely or possible that the interval between the first and second dose will be shorter than the 4 months that currently ascribed to Pfizer and Moderna?
Yeah, so we're looking at all of that, and yes, we know that that it works better if you wait a little bit longer, but it's likely for all of the vaccines that we have, as supply has come in, we'll be able to move up second doses for everybody. So if we think about our philosophy or the program that we have, the rationale for increasing the interval was twofold. One was because we know from other vaccines that a longer interval generally gives you better protection. But the other more important was that it was enabled us with the vaccine supply that we had to get more people protected with their first dose as soon as possible. And doing that protects all of us because we are able to get to that community level of reducing transmission. But now that we have additional vaccine coming in place, we can move up the second dose particularly for those people who need it for their own personal protection. So dose 2 really is about increasing our own personal protection, so that bumping up from, in the case of Pfizer, from 80-some% to 90-some%. And that it means that we can make sure that those who are older, those who are clinically vulnerable for different reasons, are able to get their vaccine dose as soon as we have the supply for dose 2. So it is likely for everybody that we're going to be able to move up that dose 2. Having said that, there's some good studies that have shown that waiting that extra period of time actually gives you a better immune response, even in older people. So it is the two aims that we're trying to get to find that right balance. And yes, people with AstraZeneca, we will make sure that we are offering second doses to people in a time that makes sure we can use up all of the AstraZeneca that we have before the end of June. And there's some for logistical reasons where people need to have it on a slightly shorter schedule. But the minimum time period is 4 weeks.
Do you have a follow-up, Keith?
Yes, last week WHO designated the B1.617 variant as a variant of concern, and we seem to have more than 300 cases as of last week. I know you say the variants are basically, we treat the variants all the same. Is there any change as a result of this designation from public health's point of view?
Yeah, no, we've been following all of them, and as you know, we've posted that on the BC CDC website, and you can see there are many different strains of the virus that are being transmitted between people in the province. Not surprisingly, the B1617, and there's several different slightly different versions of that. So it's the B1617.2 that the WHO has declared a variant of concern as opposed to a variant of interest. And it is because there's indications from the UK and from India that it is more transmissible. So that is something we are obviously concerned about. So we are watching that carefully. We did have introductions of that, and it has spread in some limited transmission, but this is where we go back to the importance of reducing transmission of all strains in the community, because you cannot tell ahead of time which strain somebody is infected with. So it is important for all of us, and we've seen that as we've taken outbreak measures, the P1 has been decreasing all across. All of the strains that we're seeing go down when we're following the important things that we need to do to stop transmissions.
Next question, Justine Hunter, Globe and Mail.
Thank you. You said a few minutes ago that many people will be coming due for their second dose in the next few weeks. I'm just wondering if you can give us any clarity on how many roughly, and is that calculated on that 12-week interval?
Yes, it is, and so it's calculated based on when people receive their vaccine first. So there's a lot of people right now. As you know, we started with healthcare workers and residents of long-term care, and we are now at the point where most of those people have received their second dose or are in the process. We had that period of time where we had very little vaccine come in at the end of February or end of January and into February. A very stressful period of time, as we recall. So there was a period there where we had a decreased number of people. So we're now getting past that period of time. If you think about that, March, April, May, we're now at the point where people are coming up again. So what we are doing is booking people at about 13 weeks so that we can be sure that they can get in and get their second dose before 16 weeks. And then we'll be looking at that. What we've done is take all of the logistics and operations as doses are coming in. We take the second dose requirements off the top. So it's in the 20 to 30,000 people over the next week, and then it goes up from there as more vaccine became available into March and April. So I don't have the exact numbers, but we can get those.
Justine, do you have a follow-up?
Yes, thank you. I've been hearing from people who, may legitimately need to travel, but they, to go to Europe this summer, they would require to be fully vaccinated to waive any sort of quarantine period. Do you foresee any kind of flexibility for people that may not want to wait as long if there is vaccine supply? You're sort of suggesting some people may be fast-tracked. I'm just wondering if anyone will have any choice in the matter.
Yeah, the short answer is not right now. We are at the point still where we have a lot of people who need to get dose 1, and we need to make sure that we have enough vaccine to provide those people who are due for dose 2 prior to the 16 weeks. That was the maximum that we had extended the interval. As we get further into the summer, there may be more opportunities for flexibility, but right now our program is full speed ahead on getting as many people the first protective dose that we can, and there's still a lot of ways to go in that.
Next question, Shannon Patterson, CTV.
Oh, hi, Dr. Henry. Now that all adults can book in British Columbia, we're going to quickly get a sense of just how many people actually want vaccines and what percentage are, say, hesitant or quite resistant to getting one. So what's your hope for that percentage in the next couple of weeks? And what's your plan to convince the remaining percentage of people who aren't registering or signing up on their own?
Yeah, these are really important questions, things that we've been wrestling with. As you know, we went from paucity to plenty in a very short period of time. So it's about changing our mindset. I think the numbers, though, that the minister presented, where we know now that over 70% of people 50 and over have been immunized. So we are seeing that people in British Columbia want this vaccine. And we've seen very good uptake across the board. But yes, there's a lot of people who may not know or may not be paying attention or may not think this applies to them. So we are looking at how do we reach out through community groups, through direct information to people. This is it's our shot campaign. We're looking at other ways. Some of the things that we have found is reaching out through workplaces where we have been able to offer vaccine to frontline workers in the last little while. And that is an important way of reminding them that, yes, you are somebody who will benefit from vaccine, not just for your own personal protection, but to protect your family and your community. So So expect to see more of that. Expect to see more of what we're seeing in places like Surrey this week, where we're working with local leaders and supporters to make it convenient for people. So I think what we're at the point right now is making it easy, removing those barriers to getting registered, getting into a clinic, making sure the clinics are convenient, that people know how to get there, that they get the information they need. And then we'll see, how much of is it that people really don't want vaccine. Right now, that seems to be a small percentage from what we're hearing for people. Really important right now is to let people know. I think I said this last week or the week before, that now's the time. It's available to all of us now, so celebrate it. Put those selfies up so that your family, your friends, everybody knows that you've taken that pledge to all of us to get through this pandemic. And it is by using immunization as the tool that we can all do together that's going to get us to where we want to be in the summer. So now's the time. Get out there, get immunized. We have more vaccine coming, and let's support each other. Tell your friends, tell your family, and we'll get through to the next phase.
I think we get a little bit of a sense of the strong effort. There's a lot of people over 70 in BC, 635,426 of whom have received their first dose already. That's 86%. And that tells us about the strong commitment, I think, to vaccination amongst people, especially in that age group, between 60 to 69, and there's still some significant appointments for people 60 to 69. I'm sure it's 78% and so on. So if you look at the numbers, there's been a strong take-up, but it can always be better. This is a crucial month for that, and why we want to drive first dose immunization. There's going to be more information about people 12 to 17 soon, but we've got to really make an effort this month to raise our levels of first dose immunization. We are going to continue, though, this effort week into week throughout the coming months, because we're going to have second dose clinics open for months and months and months after that. There's going to be a continuing opportunity to raise our level of immunization as a province, and we're not going to stop trying to lift those levels. So if you're asking what's our target is always 100%, and we're going to try and get as close to that as we possibly can. I just want to say, just with respect to Justine's question, that I don't think that people wanting to go to Europe will ever find their way in a particular priority position, but people who are clinically vulnerable or others may. But I don't think that would be ever a reason why someone would move up the list of vaccination.
Shannon, do you have a follow-up?
Yeah, Minister Dix touched on this a little bit already, but Dr. Henry, I'd be curious to see what you have to say about the role of societal or social pressure. We spoke to a man at a clinic today who said he had been eligible for a long time, but he had not been vaccinated because he was hesitant until he spoke to some family members and some coworkers who got him to change his mind. So would you like to see British Columbians kind of work on their friends and family a little bit of sort of social societal pressure could convince people who are hesitant to get vaccinated?
Sure, and I've heard this from people that I talk to as well. I heard from some Chinese Canadian groups that they were waiting to see what everybody else was doing first, or they wanted to see if their friends were okay or their family were okay. So that's why, and I think in the period of time where we didn't have a whole lot of vaccine, there was a lot of maybe a little bit of guilt that I got mine, and people are going to question it. Now's the time to say, I got mine, because it's the best thing for me and it's the best thing for my family, and let people know. Do that selfie when you're in getting your vaccine. It's a very positive thing, and I don't know how many people have been immunized, but I hear from everybody that there's this sense of optimism that comes out of getting your vaccine, and we need to share that with each other. I hear as well from my healthcare worker colleagues in different areas, oh well, nobody that I know got it, and the data actually show us that everybody did, or almost everybody did. Our rates of immunization in healthcare workers are in the high 80s and 90s across the board. In physicians, I saw some data this weekend, and we'll be releasing more of that, but physicians, 95 and 96% of physicians in the province have been immunized. Take your cue from them. They know a good thing when they see it. So this is the time where we need to spread that word that this will protect you. It means you can get back to work. It means you can get back to socializing. Immunization is what is going to get us out of this pandemic. And right now, we have to keep doing those things because we're not yet at that point where we have enough people immunized and protected, and we still have a lot of people in hospital. But we can look to some of the countries that are ahead of us in this journey. And I've said many times, I look to the UK for some of things that are happening there, and we will get back to those important things we need in our lives. And now's the time to get everybody out there. I know a lot of the young people that in my life are looking forward. They have appointments booked in the next couple of weeks, and I'm excited about that too.
Next question, Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Hoping to ask you about the possibility of a fourth wave, and people wanting to get tested for COVID keep reporting they're being turned away. So they lie and say they have symptoms, and some of those people initially turned away because they were asymptomatic have ended up testing positive. At this point, why not just let anyone seeking a test get one?
Yeah, so I've heard anecdotes of that as well. I know when I talk to my colleagues, our message out there is if you have any concerns, get tested, and we have testing available for people everywhere. Whether there's going to be a fourth wave, that is something that I think we are grappling with around the world. We know that this virus takes advantage anytime we give it people who are susceptible and the means to be transmitted. So we do have to watch this. I think we are in a good place in BC. We've seen that the measures that we know work have made a difference. We're starting to see our curve come down even as more and more people are protected through vaccination. But all bets are off if things change globally. And we need to understand that as we go into next respiratory season, so next fall, we may have to change some of the things that we're doing again. So if we look at this virus, like every virus, changes. That's its whole raison d'etre, is to reproduce. And the more people that are infected, the more times it reproduces, the more chances that a new mutation is going to arise that might give it some competitive advantage. And we've seen that most recently in India, sadly. And that's where the worry is that a variant could arise, a strain could arise that's transmitted more easily. That's what happens first. But as more people are being immunized, we might see a strain that is able to infect people who've been partially protected or have been protected from vaccine. So that is a worry. And that's something that we're monitoring, and the UK, of course, is looking at that right now. So how do we get protection levels up soon enough so that we don't give that type of a virus a chance to take hold again? So those are the things that we are watching really carefully, and it really is why, as a global community, we need to ensure that vaccines are available for everybody around the world, because we truly are not safe until everybody is safe. And we see that in countries like Brazil. We see that in India right now. We're seeing it in some countries that had previously not had severe outbreaks, in Vietnam and Indonesia, for example. So these are things that we have to pay attention to. Here right now, in our bubble here in British Columbia, we're making a difference and we're getting people protected, and that's going to help us. But it may be in the fall. When we think about this, in my public health colleagues, we talk about the scenarios that are happen. I expect this virus will be with us for years, but how it impacts us will be very different than what's happening right now. We will go to it being a virus that causes sporadic outbreaks, maybe in long-term care homes, maybe in schools, maybe in congregate settings when we come together, but that most people will be protected through immunization, so we won't have the same effects of hospitalizations and deaths that we've seen in this past year. But we will need to do public health measures. So there may be times where people will need to stay home from school or work. They'll need to wear masks in certain situations. We'll need to make sure that we have rapid testing available to detect if somebody's sick, whether they have COVID or whether they have influenza or RSV. So these are all the things that we're planning for contingencies in the fall. I'm cautiously optimistic that we get to the immunization levels that we need to protect those most at risk in the next few months and get second doses in people, that we will not be in a pandemic anymore, but we will be in a place where we can manage this virus in our lives.
Marcella, do you have a follow-up?
It is basically to the question that I asked, is that if people are being turned away when they go to get tested because they're being told they don't have symptoms, why not just let people get tested? Because there are asymptomatic people that are saying that after they got tested, they were positive.
Yes, so what I've said is that if people are concerned, they've been exposed, and we're doing a lot of asymptomatic testing and people have been exposed. If people have somebody they know who's been exposed or tested positive, then absolutely they should be tested.
Next question, Rob Buffum, CTV, Vancouver Island.
Oh, hi. Thanks for taking my question. You said that there won't be any changes to the restrictions until after the May long weekend, and when they do get lifted, it'll be a sort of a dimmer switch, a slower approach. You've obviously turned your mind to what will be lifted first. Could you kind of weigh in on whether we'll see indoor dining or things like competitive sports for kids outdoors or non-essential travel? Of those three, what will we see first?
Yes. You know, these are things that obviously we're looking at a whole bunch of different factors, and we've been consulting with a whole variety of groups. So there are many other pieces, you know, indoor religious services, an important part of many people's lives that has been suspended for a while. Sports for youth, outdoor sports versus indoor sports for adults, the travel, you know, all of these things are being worked out. And yes, it will happen slowly and gradually, and we'll pause and watch and make sure that we're not seeing a resurgence of disease as we get through this next little while, as we know that it takes some time before full protection as well from immunization. So don't expect to see on one day everything's going to come back. It's going to be gradually increasing in all different areas over a period of weeks and months.
Rob, do you have a follow-up?
I do. I'm wondering about vaccine hesitancy. When I spoke to Dr. Stanwyck on Friday, he'd expressed concern. You know, it's obviously early days for young people to be able to book an appointment, but he did express concern that younger adults were not as enthusiastic about getting the vaccine, at least on Vancouver Island, as the older folks had been. Is that a concern? I mean, we've talked about 55% of adults have had their first dose, but do you have a concern that the younger generations are going to be more difficult to convince to get that shot?
You know, I think I don't have a concern so much as I think many young people that I talk to anyway are doing it for different reasons than older people. So, and this is something that we've heard from kids in school, from young people in school, from young people who are out working. They're doing it because they want their lives back. I hear that over and over again. They want their social connections back. They want a job. They want the prospect of having a graduation. They want the ability to have in-class university. Those are important motivators for many young people. But there's also that very strong sense of, I don't want to expose my family, and I want to take care of my family too. So I think we have a whole generation of young people who are very socially minded, have a strong sense of social justice, and feel that they have a role in responding to this pandemic and protecting their families. But also they want a life again, and who can blame them? I mean, it is young people that have been most disaffected by this pandemic and have had the least influence on it. So vaccine is a way out of that, and I hear that quite a lot from the young people that I talk to.
Next question, Mary Brooks, Island Social Trends.
Hi, Dr. Henry. I'm wondering about a flavor of hesitancy regarding the second dose, because you've said today that people who've received their first dose are about 80% protected. I think that was specific to Pfizer, but that would go up to 90% with a second dose. So do you feel that there might be a danger of some people feeling, well, 80 to 90, I'm kind of okay with a first dose?
Yeah, we thought about that a lot, sort of globally as well as across this country. And really the best protection for everybody is to have that longer lasting effect. So that is the thing about the booster dose. Not only does it give you better shorter term protection, your antibody protection, but we think it gives you a more durable, so a longer lasting protection. So it is the booster that is going to see us through the next year. We don't yet know, of course, because the vaccine has only been available for a matter of months yet, how long the single dose protection lasts, but we absolutely do know that getting a booster dose will give a longer lasting protection. So it is an important part of the program. Right now, the most important thing with the amount of transmission that we have is to get first doses in as many people as possible. But we've seen, and some of what I presented last week shows you that even with a high level of protection with dose 1, it's not 100%, and even with dose 2, it's not 100%, but it's higher. And if you have a lot of virus transmitting, it can still be passed between people, and some of those people will end up with more severe illness. So the second dose is an important part of the program. Delaying it, or as we have, increasing the interval, means that we're likely to have a stronger and longer lasting impact, and that will take us through next year. So it is an important part of the program too.
Mary, do you have a follow-up?
Yes, thanks. So regarding the effectiveness of vaccines on the variants that seem to keep coming and evolving, what can you give as some level of assurance to people that getting any of the vaccines, and maybe some are better than others in this regard, will help carry them through this evolution of variants over the next couple of months, at least in this year?
Yeah, these are these are really challenging questions. So we know from the UK that both AstraZeneca and Pfizer are very effective in the real world against the B117, which is the predominant strain that was circulating in the UK for much of that, and we've seen that here as well. We've seen in the data that we have from the whole of community approach we took in Whistler, where the predominant strain that was being transmitted there was P1. And when we immunized in that community, in a community basis, we've seen rates drop off and stay down. So that tells us in the real world that this vaccine is working well against the strain that was causing the outbreak in Whistler. So those are the things that we're looking at as we go. Right now, we don't have a lot of many other strains that are causing illness, so it's hard to tell just from the data we have here. There has been some concerns with the effectiveness of some of the vaccines against the 135. The one B1135, which is the strain from South Africa. We haven't seen a lot of that here. We had a bit of a blip where there was some introduction, but as we've controlled the transmission, it's sort of faded away. So we will continue to watch that, but what we can tell you here in BC, and the data I presented last week, and the vaccine effectiveness data, which the BC CDC is pulling together, and we'll talk more about later this week, is that the vaccines we have are working to protect against everything that's circulating in BC right now.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For our final question, we go to Tanya Fletcher, CBC.
Yeah, Dr. Henry, the circuit breaker is set to expire in just over a week. You mentioned already looking at several factors when considering lifting those restrictions. But you also mentioned not wanting a new spike in the next 2 or 3 weeks. So can we take that to assume the circuit breaker will likely be extended past May 25th?
You know what? I can tell you that we are still trying to figure out how we're going to do every piece of that. So I don't have an answer for you, except that nothing is changing until after the 25th. Right now, we need to just stay the course. We're watching a whole bunch of indicators, our 7-day rolling average, the hospitalizations, the people in ICU. When can we start looking at things like restarting the surgeries that have been postponed? All of those things factor into what's happening in the next week. And we will have details about that. But I just say don't plan on things changing, lifting, and everything being different on the morning of the 25th.
Tanya, do you have a follow-up?
Yes, and if we could get a response to both questions in French from Minister Dix, that would be great. Thank you. Dr. Henry, you mentioned the possibility of a fourth wave depends on what happens globally. The head of the World Health Organization has asked wealthier nations to postpone plans to give children and teenagers COVID vaccines and instead donate supplies to lower-income countries. Is this something you would support?
So this is something that we've talked about with my colleagues across the country and the Council of Chief Medical Officers of Health. We've talked about it here. One of the key factors that went into us determining that we didn't need more AstraZeneca vaccine and that we were going to reserve the supply we had for second doses and for people who can't, for a variety of reasons, have the mRNA vaccines was because we didn't want to draw more from the global supply of this very important vaccine and make sure that it's available where it's needed in places like India and other places. So we have considered that, and we have an adequate supply of the messenger RNA vaccines to be able to satisfy all of our needs here in British Columbia. So it is a very complex issue for a variety of different reasons. One is the mRNA vaccines are much more challenging to store and to move about, and they're very delicate, even though that's getting better. So their usefulness in many countries is a challenge because there may not be access to the type of freezers, et cetera, that are needed. So that's where the vaccines like the AstraZeneca vaccines are so important globally. That did factor into our decision making about how we were going to continue to use AstraZeneca or not here in the province. We also looked at the impact of immunization in children. And there are many communities in our province where the demographics tend to be younger, and younger people, especially teenagers, are a larger proportion of that community. And providing protection to the whole community, or to the large multi-generational families, or to the environment where they're working or living, is dependent on them being protected as well. We know that children tend to have milder illness, but it is not it's not insignificant for many children, and we've seen that unfortunately here in BC too. So we did make the decision in Canada that it was important for us to protect that segment of our population, and we're moving ahead with that vaccine program. But clearly we need to be part of the global community to provide vaccines for other countries. And I've said this so many times that we are not safe until we're all safe, and that includes providing as much vaccine as we can to countries globally.
Oui, pour dire oui, qu'il est important tant que tout le monde, partout dans le monde, reçoivent leur vaccination, et ça va, on va avoir besoin d'un effort de tout le monde, tous les pays, et y compris le Canada. Et c'est pour cette raison que le Dr. Henry et ses collègues un peu partout au Canada ont pris des décisions envers AstraZeneca récemment pour limiter les doses d'AstraZeneca aux deuxième doses. Et je pense que cela démontre notre dévouement à l'idée que c'est une pandémie globale et il faut une réponse globale. Cela étant, il reste important de vacciner nos jeunes, y compris ceux qui ont moins de 18 ans. Et on va annoncer d'ici la fin de la semaine nos intentions et notre plan à cet égard. Merci beaucoup. Thank you very much.